Hi and welcome to my vlog. My name is Abdullah Albiati. I'm a GP working in the NHS in Leeds, and I thought I would start this vlog. Now, the reason behind this is because I do quite a lot of things in the NHS. So I work as a GP, local medical committee, which is the union of GPs, and we try to make decisions on behalf of the other GPs in the city. I also sit on one of the boards of NHS Digital, and most of my time is taken up with running my company called Medical Chain, which is a health tech company where we aim to empower patients to have access to their own medical records. Now, the reason I started this vlog is because I'm quite an opinionated person, and every time I'm asked to present at an event or to a group of students or to mentor some people, I'm always asked if I could do a vlog like this. There are a lot of things that need to be said which aren't being said about our healthcare, and the idea behind this vlog is to start to address some of these. I hope that in the coming weeks together we can cover some common topics and talk about issues that we have in our healthcare system. Now, the idea of this vlog or this kind of interaction between myself and yourself, it's not a blame game, but what I'm noticing is there's a massive divide between patients and health professionals. There is a complete disconnect between these two groups of people. Patients are being let down by the system, and they are taking it out on frontline staff, and I include especially reception staff, which I see in my own practice, taking quite a lot of unnecessary abuse from patients when it's not their fault and it's nothing they can do to resolve that patient's problem. And likewise, I find that a lot of doctors are getting quite run down, tired, stressed, and feel really unappreciated. And they feel as if the patients are only moaning and whining, which is not fair to patients either, because they have genuine medical problems and they need a genuine opinion to make themselves feel reassured about their health problems. And I don't blame patients when they go to A&E and wait 4 or 5 hours to get an opinion, because the alternative is waiting 4 to 6 weeks to see a GP. And we're not honest enough with patients to tell them that some of their problems don't need to see a doctor at all. And the old adage that time is a great healer really stands true in a lot of these cases. I hope in these vlogs we can cover anecdotal stories of my own practice as well as my friends and colleagues' stories, and try to give you some examples of where good things happened and bad things happened. For example, I saw a patient the other day who said it took 4 weeks for them to see me, and now that they've seen me, they no longer have the problem. I wanted to say back to the patient, well, there's your answer then. You waited long enough and the problem went away, so surely you didn't need to see a doctor. But that's the problem. We can't have these honest conversations. And in this very PC world that we have today, that we're living in, we can't have these frank discussions. I want to make it clear that I'm coming from a position of trying to help, not cause problems. And I want to make it clear that it's not a blame game and trying to say that people are lazy or unappreciative. But I think that there's a lot of journalism out there which doesn't help what we're trying to do. It doesn't help the patients and it doesn't help the doctors. I hope that in these vlogs we can cover a lot of material that the media produce as well, and highlight some of the problems that we are having in our healthcare system which we don't really talk about. There was an article in the BBC just the other day talking about how we're going to be so understaffed with GPs alone in the system, and how there's no real plan in place to recruit more GPs or train more GPs, despite what we're all being told. And I can tell you as frontline staff, we feel that pressure. We feel that there's more and more patients to see with less and less resources. I'll post a link to the article in this video, but we're already short on GPs by thousands, and will be even shorter, at least by 10,000 GPs in the coming years. And when you think each GP is meant to see about 2,000 to 3,000 patients on their own, that means we're going to be 30,000 patients short coming up very soon. We need to talk about these issues, and I hope that this will be an interactive session, and hopefully we'll both learn something. I hope you've enjoyed this, and I look forward to making the next one.